Good evening, good evening, good evening. Come on in, come on in. And if you are someplace like I am, where it is storming and the country girl kind of smirky, causing the devil be just right, as the sun is shining, but yet the wind is blowing. And it's awful. So my connection keeps going in and out, but I'm connected with you now. Welcome, welcome, welcome. Please put your name in the chat. Let us know where you're joining from. Let us know what type of birth worker you are, if you are an emerging parent, and or when your due date is. We have some awesome information for you. My name is Karen Barnett. I'm going to be moderating for you today, and I'm looking forward to the informative information that we are going to be receiving from our guest, Dr. Jane. So continue to long have a wonderful for 2025. We're excited to see you and be with you. So keep that information coming in. Make sure you're checking back for other opportunities to get information with Birthing the Magic and the phenomenal individuals that come here to share information. I see California. Thank you for joining us, Nancy. Jamie from North Carolina. And her due date is September the 7th. That's my birthday. Awesome, awesome. New York City birth doulas. Okay. Hi, Dawn. Okay, let's keep all that information coming in. Monique Whipple from Columbus, Ohio. Hi, Monique. The internet here is so bad with the storm that my other device is still buffering. So, Dr. Jane, I'm going to do my best to do your bio introduction. All I know is that you are phenomenal. And I even came prepared with a t shirt and yoga pants just in case. So, with that said, I'm going to turn it over to Dr. Jane Grant. Welcome.
Hello, I'm gonna try to share my screen really quick for you all to see me. Awesome. So hi everybody. Welcome to Beyond the Bump, your essential guide to pelvic health. I'm excited to be here. I'm gonna make sure I can still kind of see the chat too. I got two screens, so I should be able to see everything. I just want to make sure that I'm prepared. So before we jump in, I love to just introduce myself because I think it's helpful to know who I am, who I be, where I'm coming from, all that good stuff. I'm Dr. Jane Grant. I am a pelvic health specialist, a birth worker, and the founder of Invigorate Holistic Wellness. I am based in Louisville, Kentucky. This is where I was born and raised, and I'm still here in Kentucky, not for too long, but we're still here. I basically am all about redefining the way that we support women and femmes and how we address connection to our bodies, how we birth, how we bleed, how we experience pleasure, and how we heal. And I use a diverse set of skill sets and tools to do that. Some of these certifications are on the screen. But outside of these titles, I am a human first, and I love to lead with my humanity. So I love to talk about who I am outside of all of the credentials. I am a fine auntie, okay? I'm an auntie of five amazing kids. They're amazing. I'm obsessed with them. I have many other kids connected to me by love or my doula babies that I think are the cutest on the planet, but I'm just biased. I also am a traveler. I love to travel. I love my foodie. I love live music. I'm trying to learn how to play the bass guitar. I'm trying to do so many other things. I think that so much of our experiences and what we share with the world is centered around what we do. So I love to introduce more of who I am outside of just what I do. But outside of that, I love to have a good time with my friends and I love to educate people about their bodies. I think that in order for us to advocate for ourselves and see changes in the ways that we get support from our healthcare system, and how we're able to support one another, it starts with education and it starts with understanding exactly what we're experiencing, what is normal, abnormal. And I do a lot of that through the pelvic floor and pelvic health work. So it's so much fun. Clearly, I like to talk about very uncomfortable topics with people. I tell people I talk about pee, poop, and sex all day. So I'm the perfect person for or whatever you think is TMI, it's not TMI to me. Okay. So today's intention and focus is just going to be understanding the role of the pelvic floor, understanding what it does, what is it, how is it supporting our body, recognizing what that can look like for us to experience symptoms or dysfunction in the pelvic floor, and even kind of debunking some myths around postpartum healing or pelvic health. And then we'll talk a little bit about strategies to support the pelvic floor, things for recovery. If you're a birth worker, these are things that you can take into your sessions with clients. If you do postpartum care, this is some great recommendations and tips that you can offer them, and even things that you can pay attention to when they are vocalizing and sharing their experiences or what's happening with their bodies. You're able to give them proper referral and insight, which can be really helpful. And then we're going to talk a little bit about just advocating for ourselves, advocating for our pain, how to articulate those things. I think that is always really helpful to talk about in this work as well. So I love to do like a vibe check. I'm one of those people, so feel free to drop it in the chat. I want to hear if postpartum had a mixtape, what would yours be called? So if you had to put one title on your postpartum journey, if it was a mixtape that you were dropping, a hot mixtape you're dropping tonight, what would it be called? I just would love to hear from y'all, get a chance to hear from you in the chat. If you have any, I would love to hear it. A hot mess. Well, I mean, sometimes it be like that. I hope things are easing. I hope they're not as hot, messy right now, but that's real. The village showed up late. Oh, yeah, we need to do finger taps to that one. Okay. Diapers, tears, and cheers. That's great. I feel like that's a good, I feel like that's good. These are good ones. I'm gonna be a first time mom. Okay. And that's what it is. I'm gonna be a first time mom. That's your mixtape. I don't know what to expect because, who knows? Softness and survival. Oh, I like that. It's giving, yeah. Okay. Stretch marks and slow jams. Yes. These are good. Y'all need to drop these mixtapes. These are definitely good. Running on oxytocin. Okay. That's good. Storms and sunshines. This ain't for the weak, period. If men had to do it, we would have better care. Okay. I'm still standing. There we go. Still I rise. And we love it. You're still here. And that's what's important. I love that. That's so good. Diana Ross singing Someday We'll Be Together. Okay, there we go. Tender, tired, and transforming. I love that too. Come on, transformation. Yes. Can we talk about the transformation? It's so fascinating. I think clearly I'm a birth nerd. I got into this work after kind of being burned out in other settings. And I was like, I'm always fascinated about sex. I'm always fascinated about childbirth, delivery. I'm one of those people, I'm the friend in the group where people can tell me anything and I'm not going to cringe or be weird or judge you. And so I felt like I fit into this niche very well, right? And so when I started studying things, I think it's so fascinating how our body, our brains change after having children and how we're literally wired to be the sole provider and support and, protector of these children that we get to carry. And I think that is so fascinating. And I think it's truly miraculous. And it makes me want to serve women even more because they don't know how much we really do on a day to day outside of just being mothers, the way that we mother other people and not even carry life. It's also a journey because I mother a lot of people and I ain't got no kids. Okay. But yes, my neck, my back, and my pelvis. I like that. I like that. That's one of my favorite songs, My Neck and My Back. So you got me with that one. That was a good one. That's probably my favorite one. These are good, y'all. These are good. All right. So let's jump into it because I don't want to waste anybody's time. We'll jump in. What is the pelvic floor? So the pelvic floor is a group of muscles, ligaments, connective tissue that really create the base of our pelvis. They are really there to support our organs, there to play a key role in stability, in bladder and bowel function, sexual function, circulation, all those good things. So I like to tell people it's almost like having a trampoline that sits at the base of your pelvis. And so our pelvic area kind of creates the bridge between our upper body, our trunk, and our legs. Excuse me. So that pelvis is there, like, so it's literally creating a floor. If you didn't have it there, everything would just fall out of the bottom of your body. So it's there creating that support. It acts kind of responsive like a trampoline. It has somewhat of a tension that's there that's needed to keep everything in place, but it should be reflexive, responsive, and it should be mobile. So when we're talking about not having so much tension in our pelvic floor, when we're talking about having weakness, we're talking about it being over lengthened through pregnancy, postpartum, etc. It is really important to know those things and understand how it's supposed to operate so that you can understand the impacts of like pregnancy on those tissues and ligaments. So, like I said, the five main functions of the pelvic floor support the pelvic organs, so it keeps everything in that pelvic bowl. I normally have my pelvis with me, but I realized that I think I left my pelvis somewhere in the car. Um, and so, yes, if you have any questions or need any clarification, feel free to drop it in there. I can see it and I'll try to answer it. And if not, we have time at the end as well. So I can definitely answer any questions that anybody has as well. I'll try to leave some extra time at the end. But I normally have my pelvis with me. I love to be very visual with my instruction and my pelvis. Her name is Pelviana. Pelviana is not here today. She's a lady, but she's not here today. But Pelviana is really helpful because it shows how tight in the pelvic bowl our organs really are. So we have our bladder, we have our rectum, we have our uterus, and it's sitting in that pelvic bowl. So those pelvic floor muscles are keeping the, yes, she's a lady. Pelviana is a real thing. Yes, I'm for real, y'all. Yep. So she supports the pelvic organs and keeps them from falling down. Not she, but the pelvic floor muscles. Y'all got me thinking about Pelviana. I miss her. But they also help maintain bowel and bladder function. So with the bowel and bladder function, the the pelvic floor muscles are helping you retain your bladder and bowels when you need to, because you can't make it to the bathroom, but also help you void them. So if there's any issues there, of course, there's something that, could be an indicator of some dysfunction. Stabilizes the spine and the pelvis. So with the pelvic floor muscles, is really helping to add extra stability to the system. We need a lot of hip stability so that our low back can operate in a way where it's not being overworked or overcompensating for a lack of stability there. So it has that extra stability so that our pelvis is not moving all around in different positions. And we really need that. And then, of course, sexual function. It's definitely a part of our sexual experience. It is the muscles that we utilize when we're achieving like an orgasm. It is very helpful in not only our pleasure, but also in our arousal, in our desire, our libido function, all the good things. And then circulation. It helps bring blood flow from different parts of the body back up into the systems that help flush it out. So, like most muscles in our body, they kind of act as a support to pump fluid back through the body. And it is necessary to, use those muscles to also help regulate the blood flow that is in the pelvic region. If the muscles are holding too much tension or they're not as mobile, you're not getting as much circulation down there, and that can impact your sexual arousal experiences and even experience things like pain in that area. So these are kind of the main functions of the pelvic floor. Now, the impact of pregnancy on the pelvic floor, there's so many things that change, right? So there's hormones, the hormonal changes that occur during pregnancy to really help our bodies prepare, lengthen, open up for labor and delivery, for making room for this growing baby. Those hormones impact the quality, integrity of the tissues, and that impacts the pelvic floor. So things like relaxin, the progesterone, really loosens ligaments and tissues, and that can cause an increase in stability. So you may have, experienced it yourself, or may have clients and people that are, expressing to you like, oh, I feel like my pelvis just feels weird when I'm walking, or, I just feel like unstable in certain ways. It's because it's literally opening up and spreading so that they can prepare for a delivery. And so that can lead to things like incontinence, pain, prolapse, etc. Then you have increase in pressure. In our abdominal cavity, we only have so many places that pressure can go. So a lot of times pressure can be sitting down, on that pelvic floor because it sits there like a sling, and that baby's getting bigger, baby's kicking on bladder, kicking on certain parts within the body, and that increased pressure comes down on the pelvic floor, and it kind of changes the integrity of the muscles, and that can also lead to pelvic floor dysfunctions down the line. And then, of course, labor and delivery trauma like perineal tearing, nerve damage, episiotomies, impacts of so much afterwards. It also changes the pelvic floor, which is why you will see so many of us, me included, on social media. I have not been posting on social media as I normally do, but that's the best place to find me is on the internet. But you see so many of us like screaming from the mountaintops. Everybody needs pelvic floor therapy after pregnancy and postpartum, after loss, after it. We all need it because there's so much structural change that happens to the body that you need support for to be able to get back into your regular activities, movement, and more. So, any of these, I'm going to list some of these things out. So if you have ever experienced any of these symptoms, drop a heart or an emoji in the chat or something, okay? So with the different signs and symptoms of pregnancy and postpartum pelvic floor dysfunction, these can be even if you've never had a baby, but these are more common signs and symptoms that people experience. Like I said before, incontinence, leakage. So if you can't void your bladder appropriately, it could be even just not being able to fully empty your bladder and you feel like you got to keep going back. Or it can be coughing, laughing, sneezing, jumping, hollering, exercising, and experience leakage, uncontrolled leakage, bedwetting at nighttime, things like that. Pain with sexual activity, discomfort during sexual intercourse, or just feeling like maybe decreased sensations or more sensitivity around your genitals that's not necessarily, in the pleasure realm. It's kind of like uncomfortable, kind of like, oh, overwhelming. Those are also indicators of pelvic floor dysfunction. Irregular bowel movements, having constipation or difficulty passing stool, urgency or frequency, you're rushing to the bathroom, you have like 2.5. My mom always says, like, oh, I have 2.5 seconds to make it to the bathroom. And through my work, that's her favorite thing to tell people when they're talking, when she talks to people about my work. It's actually funny. She loves to talk about how she has 2.5 seconds to make it to the bathroom. So that frequency and urgency, where you're constantly going and you're constantly rushing to void, that will do it too. Pelvic pain, having pain around your tailbone, around your hips, your low back, your abdomen, your groin area. That can also, be an area that's really problematic, and that usually prompts people to go seek support because they're just in so much discomfort. Diastasis recti or diastasis recti abdominis is like the separation between the abdominal muscles. And I have a slide kind of talking about that a little bit more. But if you're noticing like core weakness, difficulty like getting up out of the bed or activating the core muscles, that is also an indicator of dysfunction. Bowel pain, so pain with bowel movements, hemorrhoids, fissures, scar-related dysfunction or discomfort. So around the C-section scar, around the perineal scars, in the perineum, areas that where it just feels like a change in sensation. Some people may have like numbness around the C-section scar or just feel totally different in the area or more tightness and pulling. Prolapse or pressure, pelvic heaviness. So prolapse is where your pelvic organs have descended down lower into your pelvis. So it may be like your uterus or your bladder is coming down the vaginal canal. It can go to as severe as you can like feel it and push it back in, or it could just feel like just a heaviness that's there. And there are studies that show that most people experience some level of prolapse after childbirth. Like I said, because you have so much change that happens there, so much pressure there, a lot that just, shifts. And so some things may be more problematic, may be more symptomatic than others. Some may be more obvious. Like I said, some people will really have their organs coming out and they can like push them back up. You can also have descension of the organs or the walls of the rectum come down the anus as well. And sometimes that can inhibit your ability to have a bowel movement. So that can look a lot of different ways for people. And then menstrual health, maybe just discomfort, difficulty with using menstrual products or severe pain during your periods to the point that it's absolutely debilitating. You can't even go anywhere for a while. That is one of those areas that people people don't think about when they think about pelvic floor therapy with us. But sometimes we do support people that are experiencing things with endometriosis or, even a history of PCOS, fibroids, cyst. Maybe you've had certain surgeries because you're preparing for conception or you're addressing things afterwards. These are big areas as well. So I saw a couple hearts in there, and like you can experience these things even if you've never given birth before. You can have leakage, you can have dysfunction. And some of the research shows that about 50% of women experience pelvic floor dysfunction prior to ever conceiving. And so it's just one of those things that we tend to struggle with in silence, and we don't really talk about it with anybody. We don't realize that we can have support. So these are definitely some common signs that we can see. Okay, so what happens during pregnancy and birth? So during pregnancy and birth, the core in the deep core system is under a lot of stretch and pressure. Like I said before, we have a lot of downward pressure. So you have that abdominal cavity that is getting bigger, it's extending out, and then there has to be somewhere for that pressure to go. So our deep core muscles get elongated, our pelvic floor muscles get elongated, and that elongation can cause weakness. And we also have the center of gravity shifting. So sometimes postural changes will occur where people are now having more back pain, having more shoulder pain and tightness, or difficulty being able to, their body being able to accommodate that significant change in weight and center of gravity. And so all of those things can definitely cause the system to be kind of like, whoa, what's going on? So, perineal tear is also another big impact with delivery, right? So, we can experience things like 1 to 4th degree tears where there's a lot of scar tissue and tightness, and that can lead to pain with sexual activity, just discomfort with using like menstrual products, issues with incontinence or prolapse, increased risk of prolapse, or just kind of having long-term dysfunction and difficulty. And so these tears, if they're not properly treated or supported after the initial healing and the initial stitches and all those good things, can lead to also some pelvic floor dysfunction that can just, go unresolved. And you just think it's normal because you just had a big baby and the baby just ripped you open. But it's like you should have support with that as well. Are y'all still with me? You still with me? You still here? Let me see some emojis or some thumbs up or something. I don't want to go too fast, but please let me know if I need to slow down. So, with the diastasis recti abdominis, I said this before, this is like a separation of the rectus muscle. So our six-pack abs, the ones that we love to see on the people in the beach and the fine men and the people's on the TV. Okay. These abs that everybody tries to obtain, some of us never get there. So okay, I got abs somewhere. It's under there somewhere. But these muscles, these primary muscles in the core, they can get separated because there is only so many places that pressure can go when you're expanding outward because the baby is growing, your belly is growing. And so it's like a way for the body to alleviate pressure somewhere. So they kind of separate to make more room so there's not so much pressure on the pelvic floor. So it's kind of a protective mechanism, even though it kind of sucks postpartum or you're noticing some bulging or coning when you're doing certain exercises or movements. It can be kind of uncomfortable and kind of like an appearance or aesthetic thing that people really get uncomfortable with in their postpartum period. So this first picture is more of an example of, a typical presentation of these muscles. And then these other pictures are an example of kind of what it looks like when there is somewhat of a separation. So you can have a separation kind of above the belly button. You can have a separation right at right in line with the belly button, or you can have it kind of under the belly button. Some people also have it just like consistently throughout the entire, experience of the middle of the muscles. So that midline of the muscles is called the linea alba. And so it's just a fibrous tissue that helps connect those muscle bellies together. So that lengthening can happen right there at any point in that linea alba. And that can help, that can impact people's ability to recruit their core muscles, to like get up out of the bed, to do sit-ups, to do certain exercises where they notice like a bulging there. They notice kind of like a bulge out in the gap or coning, what we call coning or bulging in that area when you're doing certain movements. And for some people, they may not have any type of actual what was I gonna say? Any type of impact to their functional mobility. So they may not notice any changes or any issues and they still have a gap. And then some people it's more severe where they really struggle with exercises. They really struggle with like getting up out of the bed. That's a big thing where you're like really trying to sit up and like lift your trunk up. Anytime you're lifting that trunk up, you're using these muscles. So they notice difficulty with that. And so you'll see on social media, people do deep core exercises and workouts to help like engage and close that gap and give your body some more support. So when I'm doing a postpartum assessment with people, I am assessing their diastasis recti. I'm just going through each part of each segment and kind of checking if I feel any separation. If I feel separation, I usually feel almost like the muscle bellies are squeezing my fingers. So they'll be lying back and I'll have them bring their chin to their chest and sit up like they're doing a sit up, but they're not going to go far. And then when I feel that, you can feel the muscle bellies kind of squeeze your fingers. And that's how we kind of grade it in, like a rehab environment. We'll grade it like 1 finger depth, 2 finger depth, 3 finger depth. If it's a situation where I put my whole fist in it, that might be more severe. But those are how we usually help to close that gap. So how we do that is a lot through breathing, through practicing how to distribute the air properly in the abdomen, working on posture, looking at the ribs, how they're positioned, giving you support in that way, and then watching for poor control. If there's an exercise where I notice there is more doming or coning of someone's, gap in their belly, then I'm working on how do I reduce that? So we're not putting that strain there, but we're helping the tissues kind of come back together. And so it's a lot of different ways that we approach healing diastasis recti, but it is possible to heal it. It may not close all the way, but it is possible for sure. All right, so I love to go through and like practice like really waking up and tapping into our pelvic floor. So we're gonna do that together. I'm gonna talk about a few things first about the pelvic floor before we jump into trying it ourselves. And then I get to hear from you what you notice about your pelvic floor. So what we're going to do is we're going to do diaphragmatic breathing, or what we like to call 360 breathing. So, ideally, when I'm working with someone, the biggest part of their rehab and recovery is working on kind of bringing the awareness back to the belly, bringing the awareness back to the pelvic floor so that you're able to really activate and engage those parts of your body. The belly, the abdomen changes so much during pregnancy. So we really start with breathing anytime I'm start with breathing anytime I'm working with somebody, whether it's postpartum or not. I think it's so helpful because so many of us have so many weird breathing patterns that we have taken on as time has gone on, and we don't really utilize our muscles and work on that relationship between our diaphragm and our pelvic floor well. So, the diaphragm and the pelvic floor are cousins, okay? The pelvic floor is a team player. The pelvic floor does not work solely by itself. It can do things by itself, but it is a team player. It works with the core muscles, the abdomen, it works with your glute muscles, your hip muscles. It even works with your feet, your tongue, your jaw. It has so many different connections for so many reasons. So, when I work with people, as much as people think our pelvic floor work is simply just giving you Kegels or me solely telling you to focus on your pelvic floor, some of our recovery is using a whole system approach. So, with the pelvic floor and the diaphragm, they work together and in tandem. So, as you see in these pictures right here, this first picture is is an example of inhaling. So, if we're doing this diaphragmatic breathing that we're going to do, this is the example of an inhale. So, when you inhale, your diaphragm sits under your lungs, these big, beautiful organs that help us breathe and stay alive. That diaphragm sits under the lungs. And so when we're inhaling, the lungs need space. They're big. They need some room. So they're going to be like, okay, I need to watch out. I got to breathe. I got to let this oxygen in. So because of that, the diaphragm will go down lower into the chest cavity, kind of closer to the abdomen. So it will go down to give room for the lungs to expand. So when we're inhaling, that is naturally happening. Okay. What we want to do is we want to get the pelvic floor to also lengthen and go down so that we're regulating the pressure that we feel in our abdomen. So if you see in this picture, this top little arrow at the top with the little kind of curved line right there, that is an example of the diaphragm. This other arrow that's going out is the inhale. We want the belly to fill up with air because we want to kind of regulate that pressure. So we want to breathe in, let the belly fill up with air, and it's going to expand outward. But we also want our pelvic floor to lengthen down and kind of open up. When our pelvic floor lengthens, that's when we usually poop, pee, when we fart, things like that. So we want that movement of like pushing out a tampon or a flower opening up into the seat, whatever works in your mind. That's what we want to happen during the inhale. So when we exhale, that diaphragm is naturally going to come back up. The lungs are deflating. It has more room to now come back up into the chest cavity. So it's going to move up, which means that this little area in the middle of the abdomen, it doesn't have all that pressure right there. So we can now let the pelvic floor also move up and the belly will naturally flatten. So we want this relationship where as the diaphragm moves down, the pelvic floor moves down. As the diaphragm moves up, the pelvic floor moves up. We want to train it to move in that way so it's regulating pressure and we're not putting too much strain on the pelvic tissues. Does that make sense? Give me some feedback, something so I know. Hearts, anything. Because I know when I start talking like this, it sometimes gets confusing for people because we're so used to exhaling and just letting everything go. But with this, we want the diaphragm and the pelvic floor to really work together. And that's going to be really big for regulating pressure, for helping when we're having leakage symptoms, helping when we're trying to experience more pleasure during sex, helping when we are pushing a baby out, all of those good things. We really want to learn how to control that movement and contraction. During exhale is more like release, open up to the pelvic floor. So during the exhale, we really want the pelvic floor to engage. So that is when we'll have that more of that Kegel movement. So that movement of in and up. So more of a contraction of the pelvic floor. So when we breathe, we're going to breathe in, we're going to let the belly rise, and we want the pelvic floor to lengthen like we're trying to push out a fart, push out some stool. And when we exhale, as that belly naturally flattens, we're going to let the pelvic floor come in and up. All right, y'all ready to try it? We're going to start by just doing the belly breathing part because some people have never done diaphragmatic breathing or belly breathing before. If you've ever taken any yoga classes or anything, you normally do belly breathing in yoga classes. That is a key breathing strategy or pranayama that is done in yoga. So we'll start with just belly breathing to start, and then we'll add in the pelvic floor. So don't get too focused on the pelvic floor right now, okay? So what I want you to do, I want you to try to take one hand, put it on your chest, one hand, put it on your belly. And so what we're looking for is we don't want this hand that's sitting on our chest to do so much movement up and down. We really want the hand that's on our belly to rise and fall because we want the air to go into our belly and we want our air to also come out. When we're inhaling, we're going to inhale through the nose. And when we're exhaling, we're going to exhale out of the mouth like we're blowing out candles. And we kind of want an audible exhale because that turns on our deep core muscles as well. Okay. Y'all ready? We're going to try 3 rounds of just regular belly breathing without worrying about the pelvic floor. Then we're going to add the pelvic floor in there. Okay. Hand on the chest, hand on the belly. So now we're going to start off with an inhale, inhaling slowly through the nose, filling the belly up with air, letting that hand rise. And then an exhale out of the mouth, letting that hand on the belly flatten. Okay, we're going to do it again. Inhaling in through the nose, filling the belly up with air, letting it rise. And exhale out of the mouth, slow and long. Good. Let's do it one more time. We're going to breathe, inhale in through the nose, letting that belly rise, fill with air. And then we'll do a slow exhale out of the mouth. We're going to let that belly just flatten. So now let's add in the pelvic floor component to it. So we want the pelvic floor to lengthen. So if you think about an elevator, I'm going to throw out a couple analogies. Whichever one sticks for you, take it. Okay. Everybody has different things that they like when they say or talk about the pelvic floor movements. So I'm going to just say different ones. Okay. So with the pelvic floor, when we want it to lengthen, we're thinking about an elevator that's going downstairs and then the doors are opening. And then when we're doing the contraction, we want the elevator to close and then go upstairs. Okay? That's one of the analogies. Another analogy is we think about having a blueberry. There's so many different ones. That's what I'm trying to think. They're having a blueberry and we're bringing the blueberry up a straw. So we're sucking it in and up. And then we're trying to push it out. We're pushing down and out. Okay? I don't know, whichever works for you. If you're lengthening, think about opening up your pelvic floor like a flower to the seat that you're sitting on. And then you're exhaling, and that flower is going from a bloom position to a more closed position. You should feel this in your vaginal region and in your rectum because your pelvic floor spans that entire portion. Okay. So we don't want to use the butt muscles to clench and to help us. We want it to solely focus on the pelvic floor for right now. So when we're going to get started, we're going to inhale, we're going to lengthen. When we exhale, we're going to let the pelvic floor come in and up. We're going to rest. We're going to do it again. Okay. So let's do it one more time. Let's bring that hand to the chest, one hand to the belly, because it just helps us make sure that we're helping to bring in our belly. So what we're going to do is we're going to inhale through the nose. We're going to fill that belly up with air. And as you do that, we're going to lengthen the pelvic floor to the surface that we're sitting on, allowing it to just kind of open up. And as you exhale, that belly will flatten and the pelvic floor will turn in and up. No, it's not wrong to sit more straight up when you are lengthening the body. Um, Having good posture is a good way to practice this and practice the breathing. So it's not wrong. All right, so let's do 3 rounds of that. Okay, we're gonna inhale, and we're gonna lengthen the pelvic floor. Exhale, we're gonna turn the pelvic floor in and up. Okay, 2 more times. Inhale through the nose, fill the belly up with air, open the pelvic floor to the surface. Exhale out of the mouth, allowing the belly to flatten, and the pelvic floor turns in and up. One more. Inhale in through the nose, filling that belly up with air, letting the pelvic floor lengthen and open up. Exhale, let the belly flatten, and then we want the pelvic floor to turn in and up. Okay, so I want to see, I'm curious to know what everyone felt. Did you notice that one was harder or easier than the other? The exhale is hard for you? Okay. Is it the exhale of like letting the belly flatten, or is it more of the pelvic floor movement portion of the exhale, like the contraction that was harder? Because this kind of can illuminate, oh, wow, I probably need more lengthening, the pelvic floor movement. Okay. So, and that could be a number of things. It can be a little harder to kind of engage, um, it can be harder to engage the pelvic floor. And it can be hard to engage it when you have never done it before, or you have experienced a birth or something. It could be harder to bring that mind muscle connection. And that's sometimes what we work on in a pelvic floor a lot is just rebuilding that connection between the brain and those muscles. We don't usually pay attention to them until we have pleasure or pain in that area. So working to just learn how to move it is the first step before we work on strengthening it or before we work on lengthening it. I want to just get you to move it in the directions it's supposed to go, basically. Anybody else felt anything different? When I first did this, when we do these classes, we have to learn these things, of course, and we practice on each other. So fun. When we have to do that, we have to sit in classes and actually let people put their fingers into us and do all of those things because that is part of my job. And so with that, I struggled with the lengthening portion, I struggle to inhale and lengthen because I just been so used to like just kind of exhale and letting everything relax. So it was like a weird like coordination thing for me to like compare my brain and my pelvic floor together to get it to do what it was supposed to do. So I completely understand when I'm talking to people and they don't understand it or they have trouble. I'm like, look, I had to learn it too. Don't worry. The flower analogy helped. Okay. Yeah. It definitely takes some time, but it'll do it. And it may not do it in tandem with the breathing, and that's okay because when you're learning a new movement, it's not that fluid. So it may feel a little funky, but the more you do it, and I encourage you to try this when you are moving through life, it's not going to hurt or harm anything. You can do it. I encourage my doula clients to do this during pregnancy as well. I would do it. How often would you do it? Yeah, I would do it. I literally was about to say that. I would try this multiple times a day. I tell my patients, you can do it once a day, right? You can do it once a day. I sometimes tell my patients, like, don't even worry about a time. Just do like 5 to 8 breaths. Maybe do 5 breaths and then you build yourself up to doing six. You build yourself up to doing 7 breaths. You build yourself doing 8 breaths, like 8 rounds of this breathing. Take breaks in between it because you don't want to hyperventilate and make yourself dizzy. But take your time. This is also regulating your nervous system. So much of what we experience in our pelvic floor when it comes to pelvic floor dysfunction, pain, tissue, dealing with trauma from birth, from sexual trauma, etc., is so much of it is also with our nervous system and how well our nervous system is regulating those things. So when we are able to breathe and calm our nervous system down, regulate our vagus nerve, which helps our rest and digestive nervous system kind of function and turn on, this is going to be so relaxing. Them kids getting on your nerves, stop and just breathe. Watch, watch what happens. Stop and breathe. Stop and breathe. I'm telling you, breathing is free 99. I love breathing. Okay. So but yes, this is actually beneficial for the nervous system. Absolutely. And if did anybody notice that while they were just trying to breathe, that they felt a little bit more calm, a little bit more relaxed? Sometimes you don't need a new supplement. Calm, exactly. Sometimes you don't need a new supplement. Sometimes you just need to breathe. Okay. If you're sitting in the car, you pull up to the house, sit in the car, and this is the last few minutes of silence that you can get. Breathe. Breathe in that silence. Do your pelvic floor mobility. And if you're ever having issues with like low libido or things like that, this honestly may help you as well. Start to like actually feel some arousal and some like awakening of those tissues because they're like, oh, you're breathing into me. We're waking up a little bit. So, yes, more certifications and CEUs about pelvic health. There are some that are popping up. I haven't seen many of them. I'm working on one right now myself, shameless plug, but I'm working on one right now that can be used for birth workers because I'm a birth worker and there's so many of my doula sisters and people around me that I'm just like, I would want to learn more when it comes to the pelvic floor. So I am working on one so that we can have more of, yes, have more of a awareness when it comes to our pelvic floor. Yes, yes, yes. Okay, so let's jump in. I don't want to take any more time. So healing isn't linear. When it comes to the postpartum healing, let's just get into the postpartum part of it. When it comes to postpartum healing, at that 6 week mark, there's so much that happens. The body is in such a healing phase. It's literally healing where the placenta was. It's healing internally. The organs are coming back to a better place. But in that 6 week window, that is a long time. Okay. And so there's so many people so many of my colleagues within our field that are pushing for pelvic floor therapy and therapists to come in that early 0 to 6 week period to get people support. And so one thing that I would encourage you all to do working with people, or if you're going into your delivery in September, we love September babies. My birthday is September 24th. I love September babies. But going into that period is to pay attention to how your body is feeling in that early 6 week window, but realize that that is a long period of time to not get support and assistance. And it's not harmful to go see someone or to get support from like a pelvic floor therapist during this time. If you're working with your clients, I would encourage them to breathe. That's like the easiest thing. We just worked on how you can do it for yourself. It's the same thing in that postpartum period. Whether there has been a belly birth or a vaginal birth, it is beneficial to breathe. Like I said before, we mentioned those changes that happen in pregnancy, there's a lengthening of the muscles in the abdomen. There's changes to the muscles in the abdomen. And so because of that, it feels kind of weird sometimes re-engaging and recruiting those parts of your body now that there is not a baby and something in utero there. So one of the best ways to kind of reconnect and bring those connections back to the body and to the muscles is just breathing. So we might work on 360 breathing. We might work on identifying tension patterns around the body and just gentle mobility. I did put scar mobilization here, but sometimes just breathing and kind of being in different positions can be gentle scar mobilization for someone that's had maybe a belly birth or even perineal tears without disrupting the incision and stuff as well. So in this phase, we're really encouraging that nervous system regulation, that awareness and rest. So usually in this period, when I'm seeing people, because I do see people that are maybe 3 weeks postpartum, that are maybe in that early phase, I am having them do some different breathing. So these are some basic things that I have them doing, some supine breathing. So they're lying on their back, maybe they have some pillows, their knees are bent and they're in a comfortable position, and they're just working on breathing, just slowly inhaling, letting the belly rise, exhaling, just letting the belly fall flat. We're not worried about the pelvic floor. We're not even going to do too much with it. We're just reconnecting to the parts of our bodies. We're waking up those centers within our body. Another thing is breathing on all fours. So being on hands and knees, letting the belly just gently fall and letting it kind of come back up with the exhale. So just letting it fall and come back up. It's a gentle way of just getting it moving and having some mobilization there. And some people, they're used to being very active and they want to move, they want to do things, they feel uncomfortable in their body. So they're like begging for some type of movement. And so these are the things that are definitely safest to recommend to people. And you can always recommend them to a therapist as well. It can be like some marches as well. So breathing and just lifting one leg at a time. This is definitely, keep this in mind if somebody is like, maybe they had a complicated cesarean or something. This may be a little too advanced for them. So definitely sticking with the breathing can be a big one. And then rocking on all fours. So just being on hands and knees, kind of rocking back and forth, that can be really helpful for just kind of getting some gentle movement there, gentle movement in parts of the body, maybe even some gentle hip circles, just some gentle movement in the body. I'm not a person that I like static stretches, like when you just in a stretch and you just hold it. I like them, but I think that we are so naturally dynamic as people that sometimes you're even in some like static stretches and you just start moving a little bit. If you ever work with me in any way, I will have you moving and doing all types of stuff. So I have my patients in different positions and poses, and I'll have them move around. Get the people to get back on their birth ball, do some gentle hip circles, and do their breathing in that position as well. Holding baby, breastfeeding, breathing, working on just allowing the shoulders to come down, paying attention to their posture. There's a ton of different things that can be really helpful as well. And then you can add in some gentle squatting, just body weight squats. They don't have to go all the way down to the ground, but they can go partial range, just kind of gently waking up their muscles and stuff as well. That can be easy early mobility kind of, exercises and movement in that first period. And then when we flash back where people are coming out of that fourth trimester, we're really looking at kind of reconnecting that core and glute engagement. We're really working on strengthening, addressing specific symptoms like, okay, I'm actually noticing leakage. I'm actually noticing heaviness. Wow, I've been back into into the bedroom game and it is feeling totally different than it used to. And I don't know what's going on. I feel bad because me and my partner can't have sex as much as we used to. Those are real experiences that people are having. And so at this point, that's when I'm really working on rebuilding trust with the body, reconnecting things, adding in more strengthening, more movement there. And so this can look like some simple exercises where we're doing pelvic tilts and we're just moving the pelvis back, waking up the deep core. We're doing bridges, dead bugs, bird dogs, a lot of core stability work. That's what you'll see on the people on TikTok talking about, deep core exercises or diastasis recti exercises. These are the exercises that they're using. Okay. Bear planks or squats, lunges. And so it's funny because when we usually talk about pelvic floor, people automatically go to the Kegels, when in reality, these exercises have been shown to be more impactful and effective to recruit and support the strengthening of the pelvic floor than solely isolating the pelvic floor alone. Because Kegel is basically just an isolated contraction of the pelvic floor muscles. Some man just realized that there is a contraction of the pelvic floor and decided to put their name on it. Okay, that's all a Kegel is. So it's an isolated contraction of the muscles. But like I said, the pelvic floor is a team player. So when we add in the hip exercises, when we add in the glute strengthening, when we add in those other components, we get way more recruitment and engagement of those muscles, and they're able to work in a way that supports our day-to-day movement. Right? Because our pelvic floor, we're not just sitting there and just using our pelvic floor for simple things. We really need to, use our pelvic floor while we're, bending over, cleaning up the toys, while we're kneeling on the side of the tub, helping with bath time. We use it in so many ways when we're trying to get out of the tub with those heavy carriers. There's so many ways that it's working in a lot of, different approaches that are more functional to our life. One thing that I didn't mention, I just thought of, walking, 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 walking. In that early 6 weeks, like we were saying before, in this early 6 week period, encourage your people to walk. If you are going into your postpartum period and soon, my September mamas, if walk. If you get to a point where you're like, okay, you can do walking for, 1 minute, walking around the house, 2 minutes, build it up slowly. Don't try to walk for 30 minutes, 45 minutes at a time. Walking is also a good way to encourage some movement into the body as well. So I do encourage people to walk as well. And then so this is more exercises for reconnection and strengthening, right? But when we're doing some mobility and some lengthening and we want to bring some stretching into the body, I still do tabletop breathing or all fours, cat cow pose, which has actually been shown to recruit the pelvic floor a whole lot more. So as you're arching in that top picture with the arch of the spine, when you're arching back, you put the head back and the pelvic floor is kind of, tilted forward. We can do our breathing there. So that's when we inhale, let the pelvic floor lengthen to the wall behind us. Exhale, tuck everything in, round over. This is a free game right here. I'm telling you, this is good. This is good. Okay. Inhale, you're gonna arch everything up, let it lengthen. Exhale, pull it all in. These are great ways to mobilize and move the pelvic floor. A hip flexor stretch, kind of bringing some movement in the front of the hip. Also stretching the inner thigh muscles, stretching the glutes and the figure four stretch, and a happy baby pose is a great stretch as well. So really having some lengthening, and you can do that pelvic floor breathing in any of these positions, allowing the pelvic floor to lengthen and kind of contract back and forth like that. It's perfect. Any questions about that? Did I say these help? Yeah. So like the position, somebody asked if some of these exercises help with the diastasis recti. So like the dead bug, the bird dog poses, the bear plank, those are great diastasis recti abdominis healing exercises. They're really recruiting the deep core that helps add some more stability. We only have so much time, so I can't go into more depth and nerd out about the abdomen, but there's so many different muscles that play into our deep core and into our stability. And so these type of movements really engage and recruit those muscles. But be sure that you're actually doing them correctly so you're not seeing any coning or doming in that gap area because then it's not being as effective. But yeah, this is just saying zooming out as we're going into that 6 month postpartum period all the way to a year. This is when I'm encouraging people to get back into the things that they like to do. If they like to lift, if they're runners, if they like to do other types of movement, if they have lingering symptoms, we're addressing it at this point. We're making sure that we're treating anything that's kind of like there. We're addressing how the body is continuing to progress, whether it's through breastfeeding or whether it is, through other maybe they got pregnant again or something. There are so many other ways that we help support the body so that you can get back into what feels really good as well. So, I want to highlight sex after pregnancy because this is important. Because of there's so many changes in the hormones and the tissues, it can lead to like dryness or sensitivity or low libido. So, we want to encourage people if they're first, and you may already do this if you're a birth worker, but encourage them to use like lubricant. Lube is your friend. I love lube when it comes down to it. I think we have so many weird connotations around lube, but lubricant can be really helpful in that early postpartum, sexual activity or return to sex, making sure that they feel comfortable and that they can move at their own pace. They get that 6 week clearance, and people think they can just jump back into things. And that's not always what that 6 week clearance means. That 6 week clearance is saying your body has healed and things have gone to the right size and the right places, but it doesn't actually relate to what your pelvic floor is doing and what your body is actually ready for. So use that clearance as an indicator to say, okay, I'm out of the initial healing phase, but now it's time for me to reconnect to my body, rebuild, and more. So definitely encourage if they're having any issues or any fears, hesitancies, definitely recommend them to pelvic floor therapy as well. Another thing, lube is your friend. Change positions, different positions can help with different pleasures. Using the breathing and the pelvic floor release, like we just did together, in positions like happy baby and cat cow, things like that can also warm up and lubricate the tissues and get you prepared for sex. I have a whole little sex exercise flow that I make some of my patients go through when they have pain. So this is one of the things that can be helpful as long
Oh,
as well.
I'm not talking.
And then last but not least, I just want to say there's so much that changes with our position and our posture. So because of that, we have so many changes in the neck, in the head, in the feet. So really encouraging your clients or yourself, making sure that you're just being mindful with how you're standing. You don't want to stand with too much of your butt tucked under and, underneath you and you're clenching your butt. You really want to make sure your ribs are kind of over your pelvis. You can kind of do a scan of the body, seeing how your feet are standing, making sure your shoulders are down and back. When you're carrying the car seat, you maybe have it closer to your body, maybe in front of your body, so you can stand in a better posture instead of leaning over to the side. Really doing things that can help support the body. Bath time, instead of leaning over the tub where it may cause some back pain, if you can get a little stool or something and sit down at the side of at the side of the tub or kneel at the side of the tub, one knee down, one knee up, where you can do things in the tub and still be present for bath time. It's those small tweaks that can make a bigger difference to how we feel in our bodies. The car seat is so heavy. Yes, it is. I didn't realize how heavy car seats were until my nephew was born. And I was like, oh my God. This is awful. So, yes, I definitely feel that. But indicators to see a pelvic floor therapist, if you're having any of those symptoms we discussed earlier, leakage with urine or stool, sneezing, things like that, any of those pressure, pain with intimacy, any of that stuff, those are going to be indicators to definitely get someone to go get some help as well. And making sure that you can articulate your pain and what you're experiencing, your symptoms to your providers, asking them direct questions, asking for direct referrals. If they don't feel or know anything about pelvic floor therapy, you can always seek out support independently. You can always I have a list of providers across the country that I can send and share as well. And so really sharing your goals, saying like, oh, my pain is impacting my ability to have sexual activity and we want to have kids again. And I don't want to be limited to be able to conceive because of this pain. Advocate for yourself, express the impact on your life. And that can be really helpful as well. Okay, let's see. Some questions. Would you recommend pelvic PT to help with sexual and vaginal trauma? Yes, I would definitely look at someone when you're looking for providers with that. Definitely look to see if it's someone that is, skilled in trauma-informed approaches to pelvic floor therapy, but it could be definitely a great help if you've experienced that. I do have more trauma-informed approach to how I do things, so that can be a part of it. Any advice if PT is not covered under your insurance? That's a hard one because a lot of us are out of network, just because insurance makes it really hard for us to do our job. There are a lot of times pelvic floor therapists in the more commercial outpatient physical therapy offices. Because I think these big practices that like to make the money, they realize that people are looking for that. So they find somebody on the staff that wants to get into pelvic floor. They pay for them to get that education, and then they are the ones that seeing that primary population. So you can definitely look around at your local like franchise places to see if they have anyone that also takes your insurance. That's a great option. If not, you can always reach out to a provider or someone, ask if they have some type of sliding scale option. If they have other ways that is just more like accessible or inexpensive for you. So I am at a network. I don't take insurance, but I do offer sliding scale positions for some people. I do, meet people where they are when I can. I offer HSA and FSA plans for people. I make myself available in community. So it's a ton of different ways that you can kind of find that support. But there are some really cool things popping up out here. So definitely keep on the lookout. And then doing pelvic floor therapy for heavy menstrual issues, how long does it take? How long does it take longer to see improvement? It really depends. It depends on the severity of the chronic issues that you have with your menstrual health. I wouldn't say that it is, going to be a quick fix. There's no right answer for that, but it can take some time. When you are dealing with things chronically, it can take time because you've dealt with it for so long. So it just really depends. How long does it take to recover from severe prolapse, even with immediate pelvic floor therapy? That's another one where it depends. I hate to be that person, but it is more of a it depends situation. It depends on so many other factors, and if you are able to utilize different tools to support your body. And yes, I actually consult with people virtually. I do virtual sessions and coaching with people as well. So yes, yes, yes. Glad to know that this is not normal and can be helped. Exactly. There's so much that we have learned about our bodies that is false, and it's actually harming us and harming our ability to get support. So I hope that this was definitely helpful for y'all. So thank you for nerding out with me today. I am so grateful to be here. I'm easily found. Let me go back to my other slide. I'm found on as Dr. Grant at dr.grant underscore on social media. That's the best way to keep connected with me. My website is also in the chat as well. But yes, this is a great way to stay connected. If you have any questions, I'm always here. I love answering them and connecting with people and making sure that you feel like you have what you need. So yes, anything else?
Thank you so very much, Dr. Jane.
Of
Uh,
course.
let's give her some love in the chat. Let's send some emojis her way. Thank you so much for joining us. Thank you
Thank
so much for the information. It has been amazing. And all of the doulas, I know that you have many things to add into your toolkit. And Dr. Jane, even for those of us that have hit the Route 66 and older,
Yes,
pelvic health is extremely important to us.
exactly. Exactly.
So this is a conversation that you can have across the board, and the sooner, the better.
Absolutely. Absolutely. I tell people all the time, I say our body's gonna constantly change. A lot of these changes we're not informed on. We don't even know until you get there and you're like, whoa, what is happening? So learning this
Yeah,
stuff now will help you as you age. It's not just something that's just when you're in your conception years or whatever the case, or your menstruating years. No, you're gonna need this
for life.
premenopause, menopause, postmenopause, all the things. So you need it for sure. Yes.
Okay, well, Dr. Jane, you're getting lots of thank yous. Thank you
Thank
so
you.
much. We will be emailing the recording to everyone that's here so that you'll be able to relook at this and share, share, share. Thank you so much. Thank you for joining. And please make sure that you're checking out the replays on Birthing the Magic Collaborative on the YouTube channel and sign up for every and anything that comes your way. This is Karen Barnett. I believe in Imagine Possibilities, but more importantly, I believe in birthing the magic. Thank you, Dr. Jane. Good
Yes.
night.
Bye, y'all.